You know, every time we take a medicine, we're essentially making a bet. We're betting on the potential for help, but what about the potential for harm? In this explainer, we're going to pull back the curtain on those unseen dangers. We're going to look at exactly how the very things designed to heal us can, sometimes, end up hurting us.
Okay, so let's just start with the most fundamental principle in all of pharmacology. And this comes straight from our source material. It's a really simple but powerful idea. There is no such thing as a 100% safe drug. Every single one is a double-edged sword.
Yeah, and that leads us right to the big question we're going to be exploring. It feels completely counterintuitive, doesn't it? How can something that was created specifically to make us better end up causing damage? Well, the answers are pretty fascinating, and they're incredibly important to understand.
So to get to those answers, here's our game plan. We're going to start with the predictable side effects. Then we'll dive into the much trickier, unpredictable toxic reactions. After that, we'll look at some of the most severe outcomes, and we'll wrap it all up with the risks of dangerous drug interactions. First up, predictable effects. Now this is a case where a drug, in a way, just does its job a little too well. It's actually the most common type of harmful effect, and it's directly tied to what the drug is supposed to be doing in the first place. To really get a handle on this, it helps to think of harmful effects in two big buckets. On one side, you've got the predictable effects. These are a direct extension of the drug's main job. On the other side, you've got the unpredictable ones, which can feel like they come out of left field. We'll get to those in a minute, but let's stick with the predictable ones for now. And these examples really show how logical these predictable effects can be. I mean, think about it. A drug made to lower your blood pressure might, well, lower it too much and make you dizzy. A blood thinner, an anticoagulant, logically it's going to increase the risk of bleeding. In both cases, it's the drug's main purpose, just pushed a little too far.
And here's the good news about all this. Because we know what causes these predictable effects, they are often really manageable. A lot of the time, a simple fix like lowering the dose or just switching to a different drug can solve the problem completely.
All right, let's move on to our second category, unpredictable toxic reactions. Now these are the hidden dangers. Unlike those predictable effects, these have nothing to do with the drug's main function, which makes them way more serious and a whole lot harder to see coming. So, what's the culprit behind these unpredictable reactions? Well, the villain of the story is often something called a reactive metabolite. Think of it like this. When your body processes a drug, it creates byproducts, kind of like exhaust from an engine. Most of these are totally harmless, but every now and then, one can be really unstable and toxic, and it starts attacking your body's own cells. And the damage these rogue metabolites can cause is no joke. We are talking about serious harm to vital organs, like your liver and kidneys, suppression of your bone marrow, which is what makes your blood cells. And in the worst cases, it can even trigger cancer or cause devastating harm to a developing fetus.
And here's what makes this so incredibly tricky. It's basically a genetic lottery. Your unique body chemistry determines how you process any given drug. This means a dose that's perfectly fine for one person could be absolutely catastrophic for someone else. It makes these reactions almost impossible to predict.
So what does this damage actually look like in the real world? In this next section, we're going to look at some of the most significant harmful outcomes, just to really understand what's at stake here.
A classic example of one of these unpredictable responses is an allergic reaction. This is your immune system basically getting confused and it mistakenly identifies a drug as a hostile invader and launches a full-scale attack. The most severe form, of course, is anaphylactic shock, which can be fatal. And, according to our source material, most deaths from this are actually caused by penicillin. And now for what is, honestly, one of the most sobering realities of drug harm. Just look at this number, 1 to 5%. According to the research, that's the percentage of all birth defects that are attributed to drugs taken by the mother during pregnancy. To let that sink in, let's look at some very real, very powerful examples.
The most infamous, of course, is thalidomide. It was a drug prescribed for morning sickness that tragically led to thousands of babies being born without limbs.
Or take the common blood thinner, warfarin. If it's taken during pregnancy, it can cause an underdeveloped nose and retarded growth in the fetus.
And even something as common as ethanol, alcohol, can result in the devastating, lifelong conditions that we know as fetal alcohol syndrome.
And finally, the antibiotic tetracycline. It can lead to impaired bone growth and cause permanent staining of a child's teeth. Every one of these is just a stark reminder of the incredible potential for harm. Okay, for our final section, let's talk about a risk that grows with every single new medication you add to your daily routine. dangerous drug interactions. Honestly, the best way to think about it is like a massive chemical traffic jam happening inside your body.
You see, every drug goes on a four-step journey. It gets absorbed into your system, it's distributed throughout your body metabolizes it or breaks it down, and then finally it gets excreted. The problem is, when you start taking multiple drugs at once, they can get in each other's way at any one of these four stages.
And this table gives you a few real-world examples of that traffic jam. Just look at that top row. Cimetidine, which is a common acid reducer, can slow down how your body breaks down the blood pressure drug propranolol. That can make its effects dangerously strong. Or look at the second one. Common painkillers like ibuprofen can actually ramp up the effect of blood thinners, which seriously increases the risk of bleeding.
But there's another danger lurking here: combined toxicity. This is what happens when you take two different drugs that are both potentially harmful to the same organ, say your kidneys. Now, even if the individual doses are perfectly safe on their own, taking them together can multiply the damage, creating a much more dangerous situation.
So, after all that, what have we learned? Let's do a super quick recap of the big points. First, and most importantly, all drugs carry risk, period. Second, a lot of harm is predictable. It's just a drug doing its job too well. Third, the most serious, unpredictable harm is often caused by those rogue reactive metabolites. And finally, taking multiple drugs isn't just simple addition. It creates a complex new world of entirely new risks.
And really, this all brings us to one final, crucial question. And it's not for me, it's for you. Understanding these risks isn't about being afraid of medicine. It's about being informed. It's about being empowered to take control of your own health. So the next time you talk to your doctor, the next time you see your pharmacist, remember what's at stake. What have you told them today?